Testing. Hello, everyone. This is Dr. Sarah Satcher from Regen and Rise, the Substack. And I decided to talk about what's facing everybody today, and that's the open enrollment for health insurance for those that have health insurance. Are you ready for the changes? Have you priced your insurance out? Do you know how much more it's going to cost you? And hopefully, this won't be a permanent change, and hopefully, our leaders can work something out. But in the meantime, the prices have gone up this past week, and the deadline's coming up in January and mid January for the pricing and for you to decide whether you're going to participate or not. So, what we've come to understand, the sicker you are, the more it's going to cost you. Now, since the ACA, pre-existing conditions were taken out, but I have a feeling these insurance companies probably want it to be freed up again so that they can raise the prices. And also, we're spending crazy amounts of money in the United States. In fact, it's a percentage of the gross domestic product that we spend on healthcare. So, even if you have coverage for your medications, and the average middle aged American has 2 or 3 prescriptions and 2 or 3 over the counter medications, even if you're not reading your new policy, you will find out that every service, surgery, therapy has copays and limits for the year. Forget durable medical equipment because they haven't paid for most of it for years unless you are spinal cord injury or unless you have a stroke or something like a massive brain injury or an amputation. They're not going to pay. And if you have a chronic disease, it's going to run you about $10,000 a year in travel, parking, missed time from work, co-pays, being more sick than healthy people. And this was shown in research like in the early 2000s. So it's really not debatable. But it's no longer free to be ill. And yes, being on medication, that is controlling cholesterol or blood pressure or your blood sugar, indicates chronic disease. Now, believe it or not, I've talked to patients before that they thought that because they were taking their medication and that their problem was being controlled, they thought they no longer had the disease as long as they took the medication. But I'm sorry to inform you that's not the case, and that the disease is really still there, and that the medications don't, for the most part, address the disease. The medications, for the most part, address the symptoms or the results of the disease. So we live in a place in the United States where we're exposed to a lot of toxins. And I want you to know too that a lot of this, if you're ill and if you're on medication, a lot of this is not your fault because you've been consuming products and living in the United States and thinking that things are being taken care of, but they are not. And we are going to have to force our leaders and the people responsible to detoxify where we're living and what we're exposed to. That could really help reverse a lot of disease. So, how do we all get here? And how can we go forward in a different way from now into the future? So, I'm not looking to replace health insurance, but this is a way to use it less. This membership that I'm offering is designed to help you understand your body, your risk, your leverage points before disease becomes expensive, limiting, or irreversible. Excuse me. So inside this membership, we're going to focus on reducing metabolic dysfunction, protecting the joints, brain, and the cardiovascular function of your body, rebuilding your gut health and resilience and those gut connections to the brain and other organs, learning how to interpret your labs, your symptoms, your trends, and creating a personal, realistic health plan that fits your life and your budget. So, if you'd like to know more about why I'm motivated to do this, you can read the rest of the Substack post for today. And also, if you look at the post today, you can find the link for the Regenesis Insight membership. Again, it's not a replacement for health insurance, and you do have to sign an agreement that says that you agree to keep your primary care doctor because it's not primary care. This is where we specialize in integrative and functional medicine. I will have coaches assisting me. You will have opportunities to get discounts on our services. And if you need one-on-one help, that's where getting a discount on our services could be helpful to you. You can also get discounts on your supplements, and you will have access to our protocols for things like insulin resistance, elevated blood sugars, high blood pressure, digestive issues like reflux, like dysbiosis, like constipation, diarrhea, like repeated COVID, like long COVID, like other chronic illnesses such as exposure to mold, exposure to PFAS, and other fat-soluble toxins. So we look forward to meeting you, and thanks for joining us here. Again, I'm Dr. Serena Thatcher. Bye.